Hey everybody, it's WTF Health. What's the future of health? I'm Jessica DeMassa, and I am talking to the who's who of health technology and healthcare innovation. My guest today, I am so excited to talk to this guy. This is Mark Bini. He is the Chief Patient Experience Officer at Evernorth, which, for those who have not been keeping track, is a health services company that also includes the PBM Express Scripts. And Mark, why are we dying to talk to you? Because Mark is the guy behind the Digital Health Formulary over there at Evernorth. And for those of you who know me, you know I geek out over the Digital Health Formulary all the time. Mark, it is such a pleasure to have you here today to be able to talk to you about this.
Oh, Jessica, it's a pleasure to be here with you and to be here with all of your viewers. So really excited about the conversation.
Oh my God, me too. And I'm sure they're probably like, finally, Jess, you're going to have an explanation about what this is, where it's going, because I was just so geeked out about this. This might be my health plan background from years ago. But what was cool is about this was, so Digital Health Formula, there's basically two of them attached to two big PBMs, and yours is one of them. And this was like maybe 2 summers ago, you guys started this out. Explain what it is for those who may not be as familiar with this concept and why I'm so excited about it.
Yeah, absolutely. And so now we were the first to go to market with the Digital Health Formulary. And really the reason why the market needed this approach, Jessica, was because similar to the way that medications are managed on formularies, there is just a handful, and when I say handful, I mean hundreds of thousands of digital health solutions in the marketplace worldwide. And employers and health plans find it very difficult to try to navigate, among those thousands upon thousands of solutions, which ones are clinically effective, which ones are user-friendly, and ultimately which ones can provide value in return for their healthcare dollar. And so they look at companies like Evernorth to be able to do that on their behalf. And we pulled our experience from the 30 plus years of managing medication formularies and took what we have learned there and the way that we have managed those, and we've lifted it up and have applied it to digital health. And it has been an extremely beneficial approach that our clients, our clients include employers, health plans, government, agencies, have found to be extremely advantageous.
I love to hear a little bit of the gossip about what you're hearing from those clients of yours. Like, what need has this fulfilled for them? I mean, for us on the tech side of the industry, This to me was like one of those seminal moments where it's like, oh my God, the door is open. We have a way in, people.
Yeah.
On the flip side of this, some of those employers that you work with, those health plans, government organizations, how have they benefited? Has there been a lot of interest and uptake on this?
Oh, absolutely. And I'll start with the dilemma, right? So the dilemma for an HR benefits office in a large national employer, just as an example, is that every single day they open up their inbox and they have 5, 10, 15, 20 new digital health companies that are soliciting them for business. And if you think about the makeup of an HR benefits office, you typically don't have clinicians, you typically don't have human factors researchers who understand how software and hardware work. You typically don't have health services research that can look at outcomes data and claims data and determine if it's valid or not. And so, while employers want to take advantage of digital health solutions, they just don't have the wherewithal and the expertise to be able to identify what works and what doesn't. And so that's the dilemma. And if they do choose to work directly with a digital health company, it's oftentimes fragmented from everything else that they have in place, their health benefit, their pharmacy benefit, et cetera. On top of all that, a lot of employers just simply don't want to have to go through this long, drawn-out procurement process that eat up a lot of hours of legal, expertise and procurement expertise. And so with that being the dilemma, what we have identified is just a tremendous demand for a company like Evernorth to take that burden off of their shoulders and do all of that work for them. And so ultimately, what the Digital Health Formulary allows for is it allows for employers to take the guesswork out of what works and what doesn't, because we have essentially established a very robust and expert process for evaluating digital health solutions. And I'll explain a little bit about how that works if that's of interest.
Yeah, absolutely. Let's do that now. I have so many questions, Mark. You're not getting out easy. So let's start there. I mean, let's talk about, I guess, that vetting process. I know that just recently you guys announced you've been doing this in classes, which I think is a smart way to go about it. I think it helps maybe build that comfort level, not only maybe with those employers who are looking to source the solutions in, but I would even think with a company like Evernorth. I mean, you guys are used to dealing with on the PBM side, like drug companies that have, pharmaceuticals that have been, tested, and gone through all of these rigorous processes. There's a standard way of doing business. And really with digital health solutions, this has been the problem all along, is the infrastructure needs to change to accommodate this new digital model, right?
Yeah.
So I'm curious about how you're vetting the solutions. Like, what are the criteria? We saw you add the new, like you had said, you guys launched it with one class, and you added to the formulary with a new class of services just recently. I mean, there were some cool ads in there, a caregiver
we're so excited.
care app. I mean, I want to talk through some of that stuff, but what are, generally speaking, the criteria that you look at? Like, does a startup have to be big? I mean, how many clinical trials do you need to have? Walk us through it, Mark.
Yeah, so if you've seen one digital health company, you've seen one, right? And so what we've established is a repeatable process that involves a panel of experts. So think about it as a 3-step process.
Okay.
And for those of you who have grown up in either pharmacy benefit or health plans, this will sound very familiar to a medication formulary evaluation process. So the first step of the process is we have a panel of experts, clinical experts, physicians who specialize across many different disease states, pharmacists that also specialize across disease states, health services researchers, so these are mostly master level, PhD level folks who are experts in looking at research design, outcomes data, and evaluating that data. And so this panel, as a step one, will evaluate solutions for clinical sufficiency, clinical effectiveness, and ultimately make a decision as to bringing it to the next step in the process. The next step of the process is a team of usability experts. These are human factors researchers. And we have a team actually of 100 plus people, a subset of which down in Austin, Texas, as a matter of fact, look at these solutions through the lens of usability. So, simply put, user friendliness. Think about, biometric devices, glucose meters, things like that. How easy are they to sync to your phone? How easy are they to use on a daily basis? We also look at accessibility, so people who are living with disabilities, to ensure that they're able to use these solutions. And then and only then, after we work through those first 2 steps, do we go to a value assessment. And that's essentially where Evernorth uses our size and our scale and our relationships with digital health companies, but also on behalf of our clients, and we have about over 4,000 clients, over 100 million members. We use that size and our scale to negotiate the best value. Notice I didn't say price necessarily, but the best value in return for our healthcare dollar. And what has come out of this is a win-win-win. And by that, I mean, it's a win for the member because we're able to provide them with novel solutions that help improve their lives, improve their health. It's a win for our clients because we have taken that administrative burden off of their shoulders. We've used our size and our scale to negotiate an incredible value in return for their investment in these solutions, and they're confident that they work because they've now gone through that process. And it's a win for the digital health community, the companies that are creating these solutions, because now we've created a pathway for access to millions upon millions of people who are living with chronic and complex conditions that can benefit from the solutions that they're creating. And the digital health companies can benefit by creating new revenue streams because they're providing that value to the market.
This is the thing I'm so excited about. So if everybody listening, this is why Digital Health Formulary is the thing to know. All right, I'm curious to know what you have learned in your evaluation process of these startups. Because like you said, I mean, you've seen one digital health startup, you've seen one. I love that line. But I would imagine that in aggregate, you're going through all of these, and putting them through that same process. Are there certain mistakes that health tech startups are making over and over again with pricing model, or with the way that their clinical studies are done, or the way that their data management standards are put together? Are there mistakes that you see them making, or things that they could do better that would just make their life easier if only they would think about what's happening on the other side? I mean, what have you learned that you can share with us that we can infuse into health tech to ultimately make your job easier, Mark?
Absolutely. So I would say I wouldn't necessarily frame it as mistakes per se, but what I would say is advice that I would give to startups, really 2 pieces of key advice. One is focus on where the pain is in the industry. And by pain, I mean, if you think about the customer in this case, it's typically the payer, right? So large employers, health plans. what are the pain points that they're trying to solve on behalf of their business, on behalf of their patient population, and focus your time and your energy on helping them solve those pain points. That is exactly why when we launched our first cohort and now our follow-up second cohort to the formulary, we focused on the conditions of diabetes, huge spend category, extremely complex for people that are living with the condition, cardiovascular disease, pulmonary disease, behavioral health. Now we're focusing on women's health. We're focusing on tobacco cessation, as well as musculoskeletal. And that's another big category of spend. So think about where the pain is. Think about what the root of that pain is. The root cause being complexity, lack of affordability, lack of predictability for patients. And when you think about developing your solutions, start to think about how do those solutions address those pain points. The other thing, and I think this is really important for early stage companies, is yes, if I'm an early stage company, I'm thinking about how do I get reimbursed for my solution. But instead of using this term reimbursement, think about how do I provide value to the end customer and the end user. The reimbursement will come if you create the value that the payer is willing to invest in your solution for. And just that simple reframe and just thinking about it through the lens of the customer versus the lens of the startup or the lens of the tech company will help tech companies, I think, get their foot in the door more often to provide an overview of their value proposition.
I've heard from folks who are in employers or like health benefits managers there, or people who are in health plans, that there's always some concern about the size of the startup. Like, are they able to scale to meet the needs of my population of millions of people? Tell me your take on that. I mean, because some of the solutions, like you've picked, I can rattle off some of the names of the startups that you selected to be included in the digital health formulary, and they're the big names, the ones that everybody knows: Hinge Health, Livongo, Omada's in there. Those are all startups that are rapidly scaling, are well capitalized to scale even bigger. Yeah. So what's your take on the size? Is there a size requirement to participate in the digital health formulary?
Yeah, I would say not necessarily a black and white size requirement, but absolutely, yes, you have to be able to scale. And so in order to make it onto the formulary, we're going to look at financial viability of companies. We're going to look at, through our procurement process, going to look at their ability to scale, their ability to engage patients, right? So it's one thing to have great outcomes, which are certainly important, but it's another thing to be able to do that for many people, not just a few people. So those are tickets into the door for consideration. But please don't forget, and I'm saying this to your audience, that we are an innovation-based company, right? And so the formulary is the way that we present these opportunities as a platform to our clients. But we run many pilots with many early stage companies before they even see the evaluation process of the formulary. Propeller Health, who is on the formulary today, who was acquired by ResMed last year, we started a pilot with them before they ever made it to the formulary. And we ran this pilot with a number of our clients who wanted to participate in an innovation study. We proved the results. In fact, with Propeller, we saw an 82% reduction in average days usage of the rescue inhaler that patients were overusing. And we saw an increase of adherence to the controller medication of 10 points. And those proof points helped us be confident in our own relationship with Propeller to put them onto the formulary. And so, great example. At the time, Propeller was a very small company. Not a lot of the market knew who they were. But together, we created a proof point that propelled them onto the formulary. So, I would say if you're not ready for the formulary today, it's not a no from us. It's maybe a not now. And here are the things that have to be true in order for us to move forward. And I'll leave you with one other component here that I think is important. We made a conscious decision when we launched the formulary back in late 2019 to not make known or not make public the companies that we evaluated that didn't make it onto the formulary initially. And we did that because we want to see this industry grow. We want to see these companies continue to develop proof points that can help people improve their lives, help our payers improve their total cost of care. And we felt like to publish an exclusion list or to publish a list of companies that we evaluated that didn't make the cut would be extremely irresponsible in that mission. And so we want to be a partner of choice to these companies.
That's great. I like that a lot. And I think too, especially that the right way to deal with an industry that is new and trying to grow and feeling its way out in a lot of ways. So question for you on the future for the digital health formulary itself. Mark, how big does this thing get? I mean, it's technology, it's scalable. Is this like an app store of healthcare solutions you're going to be building, only it's going to work like the same way that a drug formulary works? I mean,
Yeah.
I think to myself, like, wow, you could really do some very specific things for very small patient populations if you wanted to. And because it's all digital, like, what does it matter? I mean, what's your vision for the future? What does this look like 5 years out?
Yeah, and I appreciate that question because that's the vision is essentially a platform that enables access to millions and millions of people who can benefit from solutions that work. And we'll continue to build out the formulary. We'll continue to expand the formulary horizontally into different disease categories. We're looking at rare disease now. We're looking at oncology. We're looking at longitudinal virtual health solutions. And a number of other digital therapeutics. And I do think that as time goes on, that you're going to start to see this evolve to be very similar to the way medication formularies, are covered by plans. And so today, in large part, you don't typically see these digital health solutions covered under a drug benefit, but they're covered through Express Scripts under separate kind of pathways. I think you're going to start to see progression towards that over time.
So they might actually one day fit into the way that we do healthcare reimbursement broadly.
Yeah, and we technically can do that today from a technology standpoint. It's really a client by client decision as to whether or not they want to cover digital health solutions underneath a drug benefit, as an example. And as proof becomes stronger, evidence becomes stronger in regard to the solution's efficacy and effectiveness, I think you'll see employers who are willing to be progressive and take that step.
Efficacy, effectiveness, what about utilization? Because I'm curious too, as you're watching this, I mean, things must be going well. You added a second class. Yeah. So, I'm curious as time goes on, what, because that's always been a problem too, right? Is like, engagement. Like how much are people using this? And in terms of, and part of efficacy maybe is engagement, how many people are engaged enough with the digital health solution in order to render it effective long-term or to stay committed to it over a period of time. So what are you looking at there? I have to imagine that that's going to be part of this 3-step framework, especially as time goes on. So what does that look like? What are you seeing like in these early days in terms of engagement?
That's a great question and a great point. Engagement is so important to the equation in the way that we evaluate these solutions. It's built into what I described as our process. I would still say, in large part, we can do a much better job as an industry developing solutions that have a low barrier of entry in terms of patients being willing to try them or to activate. That is still a major pain point that we have to overcome, right? So, while we launched the first formulary and while we continue to add solutions and we continue to drive value, quantifiable value for our clients and for our patients, we still have a lot of room to improve. And so, engagement, and I would say in particular upfront, like just getting activated is an opportunity for improvement for us. So I think that's a great point. I think the other thing that I would mention is that we don't typically look at these solutions through straw holes, meaning, while we have many solutions on our formulary, clients are not, they can enroll in these ad hoc, but what we're also seeing is a tremendous demand for comprehensive approaches where these solutions can be used together to drive better outcomes for clients. We have a platform that we call Health Connect 360, which is an advanced analytical platform that helps us ingest data from all of these different companies, from their devices, from their applications, as well as solutions that we've built organically. And it allows for care teams to deploy these solutions to people when they need them. So for instance, not every patient who's living with diabetes needs a smart glucose meter, right? They may need a different intervention. And so this platform is helping us really be smart about the way that we target patients with the appropriate intervention.
All right, Mark, I want to ask you one last question, and I want to ask about as far as like where you guys are looking next. When it comes to like you've been very measured in terms of the types of solutions that you've been adding and when you've been adding them. It's been like a once a year kind of thing. I mean, what's the near-term plan, especially as we're headed into 2021? We're still in the middle of this pandemic. there's a lot of different expectations depending on where you're sitting in terms of what's going to happen with healthcare coverage and healthcare plans next year. So, I mean, what are you looking at? I mean, what kinds of solutions are, I guess, like top of the list in terms of what you want to bring into the formulary, into the next cohort? And will there be more cohorts more frequently as we move forward?
Yeah, so I'll address your last question first. I think the coolest thing about inventing the first digital health formulary is that you don't have to be constrained by conventional thinking in terms of when you add to the formulary or when you expand the formulary. Most of these solutions don't require a plan design change for clients who are enrolled in them. So we will continue to add solutions as demand is occurring for those. And there will be a regular cadence, but we're not going to constrain ourselves to that. So we'll add them throughout the year. In terms of where we're seeing demand and where we'll head next, we'll expand in our existing categories because there's a lot of competition and really interesting solutions that are starting to emerge in the space of cardiometabolic disease as well as pulmonary conditions, MSK, et cetera. But the areas of opportunity for us include navigation. So if you think about, the healthcare system is extremely complex, and the average consumer, although we don't believe anyone is average, but if you think about healthcare consumers, their time and their mind share is no match for the complexity that we have put on these people. And so, how can we leverage digital experiences to help them navigate more effectively their own benefit, as well as some of these solutions that you have already seen on our formulary in an effective way. So look for those types of things. I mentioned earlier longitudinal virtual care, digital front doors that allow for patients to arrive at an entry point, a digital entry point, and to be able to identify based on their needs and to be triaged, if you will, to appropriate care paths. And those care paths will include other solutions that you have already seen on our formulary, as well as the expansion of that formulary. I also mentioned oncology. This is a tremendous area of opportunity. Many of us have been impacted by this, terrible, terrible disease, either directly or family members or friends. And I've seen it firsthand when people are thrown into that overnight, that traumatic, situation of being identifying someone in their family has cancer. Now all of a sudden you have 7, 8, 9 medications on a regimen that you weren't taking before. You have stress and anxiety and depression that set in. We are really bullish on digital's role in helping manage complex regimens, helping with all of the behavioral components that come along with cancer, as well as improving the ease or taking the burden off of caregivers who are providing care to loved ones who are also trying to take care of themselves at the same time. And so those are some areas of opportunity for us. But sky's the limit with all of this because, as you mentioned, it's digital and it's scalable. And the key is where is the pain the greatest, and how can we attack that?
Mark, I am so excited about this, and I'm sure that we have a bunch of converts as well who are like, yes, digital health formulary. No, I mean, the thing that's so smart about it, I just have to say, it's like this is digital health's opportunity to meet the health system where it's at. And get integrated in a way where it's like, not only is it safe and there's these processes in place for the vetting and for all of those things, but it's like also it fits into the payment model. And this is where it's like in a nice bow. Thank you. Thank you for wrapping that up for us and putting this out there.
Yeah, no, my pleasure. Really appreciate the opportunity to share our story, and we're excited about where it's going to take us.
All right. Well, we look forward to checking in with you again, especially as we head into what's promising to be a really interesting year for healthcare next year. So we'll definitely have to give you a ping, and we'll see what happens next with that digital health formulary. Mark, thank you so much. Everybody, this was Mark Bini. He is with Evernorth. You've got to go and Google what you can about this.
Yep. Thank you. Thank you, Jessica. Really appreciate it.
Thank you. Likewise. Right. I'm Jessica DeMassa with WTF Health. If you want to check out other conversations with health tech leaders, please visit my YouTube channel. That is youtube.com/WTF Health. We'll talk to you guys soon. Take care.